Danielle Jones. I had the pleasure of speaking with Zakira a few times, and I was talking to a new friend, I think, Tasha, that I made, and I told her, I said, even if I wasn't sure about coming after talking to Zakira, I was going to come, because she really made me feel like she understood where I was coming from. She made me feel comfortable. If I had any questions, she was there. And out of all the companies that I researched, she's the only one that actually picked up the phone and called me.
Really?
And so that made me feel good. So I'm excited.
I guess I'll reach out and tell her.
Yes.
Yes.
Okay.
Like Diana Ross.
There you go.
Very Diana Ross. Okay. Very much so.
My name is Adele Latasha Brown, and I'm from South Carolina, and I'm glad to be here with y'all today. I've been actually seeing some of y'all on YouTube, Facebook, or whatever, especially the holy water down there on the floor. And Mr. Carl, I spoke to him and told him I'll be here, so I'm glad to be here.
Thank you. We're glad to have you.
All right.
Good afternoon. My name is Richard Davis. I was invited by D. Moore from Wilmington, staying in Raleigh,
Oh, Port City. Okay.
to learn a little something. Thank you.
Thank you. Absolutely.
My name is Pierre Kearney, and I was invited by Angelica, and I'm from Raleigh.
Oh, nice.
Yes. My name is Angelica Littlejohn. I am benefit consultant, just joined by Miss Akira, and I brought my cousin Sierra.
Oh, awesome.
My name is Dale Williams. I'm from Fayetteville. I was invited by my sponsor, also Ms. Zakira Losada.
Thanks, Dale. Love Dale. See you in a second.
My name is Lily Friday. I am from Charlotte. Well, I live in Charlotte. I'm actually from Wilmington.
Okay.
And Zakira invited me.
All right. Let's get this. Okay, look, we're going to try this hand clap. Yes. It's Saturday, they out. Let's go. All right. Who's this lovely lady right here in the middle? I don't want to miss her.
This is Malia.
Malia. Can everybody say hi, Malia?
Hi, Malia.
Awesome. Thank you. Absolutely. We want to acknowledge you. We love kids.
Hello, I'm Janira, and I'm from Raleigh, and I was invited by my sponsor, who's Miss Jeannie Jones, down in Texas.
Awesome. All right. D, if you can stand up. Because they don't know you.
Well, I am Dee, also known as Danita Moore. I've been with Ameriplan for 10 years now. I'm an RSD, and I brought three lovely guests. I got some more people filing in soon.
No worries.
But just want to have my guests, go ahead and announce themselves as well.
Perfect. All right. You've been charged.
Hi, my name is Janice Hendricks. I live in Raleigh, North Carolina. I was invited by the fabulous.
Very much so. Absolutely. Thank you. Can we give her a hand clap? It's not easy standing up and introducing people you don't know.
Hello, everyone. My name is Misha Davis. I was invited by Miss Danita Moore. Glad to be here.
Well, why y'all didn't tell me to wear stripes today? I didn't know that. Okay, let's give her a hand clap. Y'all black and stripes. I would put it on. Let me fatigue at home. Get that class like that, right?
My name is Lucretia Moran, also known as Keisha.
Oh, wow.
And I was invited by Zakira.
All right, nice. Thank you. I miss you. And I know you want me to miss you, but I can't. Because you look so nice in that blouse. Stand up for me.
Thank you.
My name is
Vanessa Cox.
I'm sorry.
And I was invited by Demetrius.
You got it. Perfect. Awesome. And that was one thing I didn't do, which is introduce myself, which was very unprofessional. But you guys know, my name is Amy Pittman. I'm a national sales rep with Ameriplan. I started out as a member first, using the product. So it is an honor just to have you all here spending your Saturday with us. So now we're going to get started with the presentation. This next individual, I absolutely love her. She is the Diana Ross. She likes to be referred to as the Beyonce. She loves Beyonce. But she is, she has her own credentials in her own right. She was a stay-at-home mom. She was a broke cashier from Home Depot. But more importantly, she just got a hold of Ameriplan and just took off running. She's also a Ruby member. She's a top producer. She's part of the top producers list, which is like the top 100 here out of a ton, over like 10,000 IBOs here, or benefits consultants, that's the new term. And so she actually, with the company, she was able to start a business.
Everybody, but none of us would be here if it wasn't for Amy. So let's just give it up for Amy. And so my job today is to talk to you. First of all, one, you're gonna learn who we are, what we do, how we get paid, okay? I usually like the how we get paid part, but we got a special guest, and we're gonna talk about who we are and the part about what we do. So what you're about to see is about these amazing programs that we market in the general public, the need that we have, and how we have really helped communities. Like you heard that Beyonce song, we really want to leave a mark, and that's what Ameriplan's been doing for the past 25 years. These are our awesome brothers, Dennis and Daniel Bloom. They're our founders of our company. They have so many accolades. They're actually part of the board of the regulatory committee that actually regulates our industry, which is called the Consumer-Driven Healthcare, okay? We also have had the Ernst & Young Entrepreneur of the Year Award several different times. If you don't know what that is, that just means that they rock, okay? Now, we also have an A+ rating on the Better Business Bureau. Everybody know what that is? Say aye. Aye. Okay, so that means that we are basically have an accreditation, been around since 1992, multi-million-dollar corporation. And that really sets us apart from many companies, okay? Our mission is to help families obtain affordable health care. Currently, we have over 2 million members who have saved over $1 billion with a B dollars because of Ameriplan, okay? How many people think it's a need for health care? It's a health care crisis in America today. Okay, people are struggling when it comes to health care. They're not going to get their teeth cleaned. They're not going to get prescriptions filled. And we have that opportunity to change that. We have a huge demand. Back in 1992, healthcare was a problem, but it was nothing like it is today. 156 million Americans do not have a dental plan. And you probably know them, and if you don't know them, it doesn't matter because we love to do attraction marketing. Now, just here, as you can see, Good Morning America had a huge spread on our company. And this was not a planned interview, anything like that. We had a bunch of calls come into our corporate office saying, sign me up, because they saw us on Good Morning America. This wasn't anything planned. And so we were like, wow, we had a third-party validation without anybody actually planning it or setting it up. And let's actually see what they had to say about Ameriplan. Wait, I think I clicked it too quick.
Click it on the laptop.
Get ready for some daunting numbers. According to the National Coalition on Healthcare, American families spent an average of $6,000 out of pocket on health insurance and other medical costs, and that's a number expected to rise to $9,000. So in today's edition of America's Money, we asked financial contributor Melody Hobson, president of Ariel Investments, to tackle this problem, and she's come up with at least 5 ways to cut costs without sacrificing quality of care. Hey Melody, this is important stuff here, and the first tip is something that I hadn't heard about before: discount clubs for healthcare?
That's right. These are discount medical plans. Think of it like a Sam's Club or a Costco, but for medical plans. You pay a monthly fee, somewhere in the neighborhood of $12 to $30, to cover your entire household. And you get discounts in everything from vision to dentists to chiropractors to pharmacy drugs to a host of doctors. You save a significant amount of money. Now here is what I must underscore. This is not insurance. So you don't pay a premium, you don't pay a deductible, you can't be denied. You pay the cost out of pocket, and you can save some significant money. So an example, there's something called Ameriplan USA. You'll save 65% on things like crowns and fillings in terms of dental work. 80% on preventative care like getting your teeth cleaned. So these are big, big savings. But don't go ditching your insurance because of this. I'm not suggesting that at all.
Right, this fills in the gaps.
That's right. So this is for people, maybe you have a huge deductible and you can go this route instead, or you've run through all of your insurance coverage for the whole year and you need a procedure, you can go this way, or you don't have any insurance at all. This could be an option.
All right. Absolutely. Y'all better find part of that. All right. And so these are the 3 programs that we offer. I'm going to run through them very quickly, but because of technology, you won't have to really hear me say too much. And this video is going to explain our Dental Plus package.
You probably don't have any form of dental, vision, prescription, or chiropractic coverage. But what if there was a way to simply reduce those costs by 30, 50, 60, up to
30% or more without the expense or hassle of dealing with insurance. There is truly no limit to the savings you can receive as a member of Ameriplan. Dental services include all specialists such as periodontists, oral surgeons, and orthodontics, as well as braces for children and adults. There is no limit on the number of visits or services you can use, and you can change dentists whenever you want.
Last year, I probably saved about $2,000. I had a crown done, you know, that was going to be $800. I paid $250. I had a root canal, which was $600, paid $195.
There are currently over 12,000 optical providers nationwide, including most national chains such as Lens Crafters, Pearl Vision, and this plan is the only national discount eyewear plan endorsed by the Opticians Association of America.
The glasses I have on in Eye Masters were $464, and I ended up paying $237 for them with the plan.
For your prescription drug needs, there are over 50,000 retail pharmacy locations nationwide, including most national chain pharmacies such as Walgreens, Eckerd, Kmart, and Walmart.
They broke my wrist and I had 3 prescriptions. And I saved, one was 32 and I paid 20, and it was 20 and I paid 10, and it was 20 and I paid $4.
Over 6,000 chiropractors participate in our chiropractic network, which provides for a free initial consultation, a 50% savings on all diagnostic services and required x-rays, and a 30% savings on all other services.
Certain health plans just don't allow for chiropractic, or in other cases, sometimes optometrists or dentists, and this gives them a discount into our office.
It's clear that Ameriplan is dedicated to helping its members receive professional dental, vision, prescription, and chiropractic care at affordable prices.
All right. Okay, so that plan is $24.95. Everybody say $24.95. $24.95. That's for an entire household. When we say household, we mean every single person that lives at this address. Let's say if we all live together, it would be really rough in the morning. But seriously, we will all have the benefits for $24.95 a month, not per person, but for the one household. My biggest household, I believe, was like 10. Okay, I guess they had a big house, I don't know. But out of the entire United States, we have 120,000 dental providers. Ameriplan has 80,000 of those providers within network. Then we have our Ameriplan Med Plus, and it's an amazing service. I'll tell you how I use the plan shortly, but we have another video to help my job be a lot easier.
Telemedicine is like having a doctor in the family. You have around-the-clock 24/7 physician access. Convenient quality care is only a click or call away. Telemedicine is the nationwide alternative to expensive and unnecessary in-office doctor visits. It includes diagnostic consultations. You can call or email one of our doctors 24/7 for diagnosis and a prescription for only $25 per call. Information-only medical consultations are free and unlimited for general advice. Call or email a physician without long waits at the doctor's office.
Frustrated by the high costs of prescriptions?
We have over 50,000 retail pharmacy locations nationwide, including most national chain pharmacies, such as CVS, Walgreens, Target, and Rite Aid.
And we offer special mail order savings on most high-volume maintenance-type drugs.
Could use the Ameriplan card there at my local pharmacy, and I discovered I would save 50% there. But when I found I could save 89% with a mail order, I went for that the next month.
I paid $6 for 3 prescriptions. The savings was off the chart.
Ameriplan also includes ancillary medical care, such as labs, x-rays, MRIs, physical therapy, and nutritional counseling.
Laboratory fees for a lipid panel normally cost $88, but with Ameriplan, you only pay $11. That's an 87% savings.
Ameriplan Health also includes hospital advocacy, a valuable service that can save you dramatic amounts of money. How does it work? Simple. If you are a member and are hospitalized, you are assigned an advocate who will negotiate directly with the hospital to drastically reduce the costs. In fact, one of our members recently saved over $100,000 after suffering a massive heart attack just 5 days after joining Ameriplan. He had no insurance and would have been bankrupted, but Ameriplan's hospital advocacy saved the day and saved his family over $100,000.
All right. Okay. So that program, again, is $24.95. This is our last program. We don't have a video on that because it's a combination of Plan 1 and Plan 2. Over the last 5 years, 60% of all bankruptcies have been due to unpaid medical bills. You understand that, right? You're trying to buy a house, you got all the medical bills on your credit, it's not going to happen. And so anybody in this room who has a hospital bill that exceeds $2,500 at any hospital, no matter if you're in North Carolina or from my hometown, Jersey, or across the seas, wherever you're at, you can actually get help for that, okay? Our last program is Ameriplan Deluxe Plus. It's a combination of Plan 1 and Plan 2. It's the dental, the vision, the prescription, the chiropractic. It's the telemedicine, everything you just heard, along with the non-medical features as well. So we understand that everyone, because of this type of service, you don't want to be using dental every month. You got some serious, some people have those issues, but we don't want you to have to use these type of services all the time. So in the meantime, we have a lot of the non-medical. So if you shop online, anybody shop online besides me? Okay. So if you shop online, you get cash back and discounts for doing it online. And between that time, Office Depot, Dell computers, all of that is included as well. And so instead of boring you and reading these testimonies, we have some actual people in the room who've used the plan. So if you have used the plan, we want you to hop up, let us know your name, the service that you used, and how much you actually saved. All right, we'll start over there.
Yes, my name is Demetrius Brown out of Raleigh, North Carolina. I use the dental program. Typically, to get an annual cleaning and an x-ray, it's about $150 to $180, but with this plan, I pay less than $50.
Nice. All right, clap it up. Carl?
Yes, my name is Carl Ryans, and I have traditional insurance in my household, but they don't cover designer frames, and I use the vision service here with Ameriplan. Okay, so the glasses I have on these are Oakleys, which are designers as well. They normally, the actual cost is $350 for the glasses, but with the Ameriplan, I only pay $100, so I save myself over $200 for the application.
Wow.
My name is Rosalind Perkins, and I use the dental plan. I got 3 comprehensive exams, x-rays, and a general cleaning for $127. It was regular $256, so I saved $129. Thank you, Ameriplan.
Well, I'm Dee Moore, as I said. I've been saving with Ameriplan for the past 10 years. It has been excellent. I have used Office Depot. I get copies for like 2 cents a piece. I actually brought something with me today. It was one of my proudest savings ever. So I did have LASIK a couple of years ago because I got tired of paying so much for glasses, but I actually, these were so hot. When you see something hot, you gotta get it, even if it's got a name on it. I'm not usually a name person, but I was like, man, these are so hot. These glasses were $419. So I was like, let me see if I can get it cheaper with Ameriplan. I went on the website, got this complete pair of glasses, all the extras, UV coating, high density or index or whatever they call it, all that stuff for $174. Wow.
Dee and Carl want everyone to know they were designer friends. Amy too, but she got like 100. Go ahead.
I promise I have a lot of friends. But we're not going to do vision. I'm going to do non-medical. So you heard Zakir talk about Ameriplan Cashback Saver. So I need an internet, unfortunately, and I didn't want Time Warner anymore. So I went with AT&T. So I went through the online Cashback Saver. I was able to get my service turned off, plus they gave me a $75 credit along with that as well, plus I earned cash back. So with Ameriplan, I actually saved the activation fee that Time Warner charges.
Oh, no, Time Warner backs it up, so I may have to switch. So I use the benefits also. I actually use the hospital advocacy plan because I have a 13-year-old and a 14-year-old, but my 13-year-old, I had a anesthesiology bill from way back when I had them. I forgot about it. But it was over $2,500. It reduced it down to $256. They gave me even a payment plan option of $50 a month, but I just went ahead and paid it off. I also utilize, I'm trying to think of something that y'all didn't say. I already said glasses, y'all said glasses already. Oh, root canal. Root canal would have been $1,200. Out here is only $600 to get a root canal. And so that was a big savings. And I'm trying to think something else. I saved a lot. Office Depot, $25.
You did the hospital
Oh, my prescription. And also the telemedicine. My face had broke out, sometimes it act up. And I called telemedicine. If I would have went to a dermatologist, emergency visit would have been $75. I paid $17.50 for that diagnostic. My prescription was $79, and you know how the girl was laughing when she said I paid $6. That's how I did, because they said $32. I was like, thank you, Ameriplan. So not only did I save money, I also saved time as well, because I didn't have to get up, go wait in the office, be around a bunch of sick people coughing on me, and you get the picture. But I know most of you didn't come into this to understand how to save money, okay? But you need to know what you're marketing, because if you don't feel good about the services that you market, you're not going to tell nobody else about this. You're going to become like a secret agent. So you have to feel good about it. And when I looked at this company several years ago, I was a broke cashier working at Home Depot on welfare. I know what an EBT card looked like. Struggling, working 45 hours a week, still not earning enough income. And I did what everybody else did. I went out, got a part-time job, and that part-time income went to after-care costs, before-care costs. I literally felt like, I get emotional, like I was paying somebody to take care of my kids. And so I was determined, okay, I was determined to figure out to earn some additional income differently, and came across my first company. I earned about $400 or $500, but I did everything they told me not to do. If they said go this way, I went that way. If they said go that way, I went this way. I still managed to earn some money. It just wasn't a good match. 2 years later, I needed services. I heard everything that I just explained to you. Got started in my first 11 days with this company. I earned over $650-something. But that wasn't like huge, because that's about what I was earning. But I did it in 15 hours, and I did it from home. Okay, needless to say, the past 7 years, I've worked for nobody else. And I've become a national. She said all of that good stuff. We just scratching the surface. But the greatest thing, the biggest reward Ameriplan has given me is my sons now are really 14 and 13. That just gave me goosebumps saying I have a high schooler. But anyway, they're student athletes. They're all into school. They always have different things. My son has homecoming later. And the most rewarding thing is that you don't have to choose between being there for your family and the things that matter versus working. Because at the end of the day, if I can take this, you can work. And so we have a guest speaker tonight, or today, this afternoon. I'm usually on a call doing this. And he hails all the way from New Jersey, my home state. And then he has a house in Virginia, too. So traditionally, he's a bail bondsman and private investigator. I think we got started around the same time. He was a little bit before me, but he was rocking it out. I was like, gosh, you got all the people in there doing it. But one of the things that he'll share more about his story, but as a traditional business owner, Ameriplan has not just filling the gaps for him, but definitely be able to stand. Because if you know anything about entrepreneurship and being a business owner, storefront business owner, things can happen. And when you have something like Ameriplan near, that'll just alleviate that. But today, he's a national sales director. He's a superstar consultant. He's part of the Millennium Club, doing an awesome job, Mr. Carl Ryan. Everybody,
Did y'all get a whiff of that music?
Yeah.
That's Pink Floyd. I'm here in North Carolina, but that's New Jersey. Pink Floyd.
Jersey.
So we're here to talk about money. Let's give it up again for the queen here of North Carolina. Also from my hometown, New Jersey. I watched this young lady grow tremendously, and she's just awesome. That's the only word you can put. So she can do it, guess what? We all can. You know, great story. It's a great story. Okay, so y'all gonna have to bear with me. This is North Carolina's thing, and I'm a New Jersey, so I'm gonna give it a New Jersey flavor and do the best I can. So I guess she said just press this button and the rest is all home. All right, but before I press this button, we got something up here that's very important that Zakira talked about, is that's network marketing. And since I'm here to talk about money, okay, our mindsets were totally different. We were taught go to school, get education, get a job, okay, and we pay bills, okay. Well, here you're gonna find out that let me ask y'all anyway, how many of y'all could use some extra money? This is talking about money. Okay. Well, the thing is, why network marketing, okay? Very simple. Well, if you want to earn some extra money, you want to get into network marketing. And that's what Ameriplan is, a network marketing company, okay? And you get to earn extra income, which we all need. We just raised our hand to do so. How many of us need more time freedom? Yeah, Zakira just got finished talking about she could spend time, go to all her boys' football games, baseball games, whatever they do. She don't have to worry about her job telling her she cannot go. She can go. And that's absolutely amazing, okay? And I do the same thing for my son. He loves soccer, and I take him to school in the morning, and I can go to all his stuff. I'm the only father that be on those bus trips. That's crazy. I mean, only male. I mean, a bunch of kids and me. Trying to deal with all those crazy kids, man. But it's amazing that I can do that, and he can count on me to be the dad that, you know, because all the other parents can't go. They have to be at work, okay? So time freedom is another thing. You get the bill for retirement, okay? Anybody here retired already? Okay. I just wanted to ask that because some of us do, and then we find out a year or two later we have to do what? Go right back to work again, and normally go somewhere where it's not the same income or definitely not the same work. Be your own, have your own, okay? Your own business. Who in here would love to have their own business? Anybody? Yeah, work for yourself, right? Okay? And the other thing is, one of my favorites is to help others. And I did this in New Jersey, and I got froze for it because I'm not that biblical, but I think that was in the Bible, right? So before I make the wrong quotes again, I came prepared this time. Because I always say, oh, that's in the Bible. They be like, where? Peter 4:10. Use your God-given gift to serve others. Okay? Proverbs 11:25. The generous will prosper. Those who refresh others will themselves be refreshed. Okay, back to the So don't mess with me. Okay? You get to, hey, thank you. You also get to achieve financial freedom. And I think that's what all of us are here for, to achieve financial freedom. And the most important, too, is to meet new people. Wow. Just look at this. I'm happy to meet Tasha finally, right? I have everyone in this room that's in Ameriplan, from Zakira, from Amy, Demetrius. I did not know any of them until I came into network marketing. So I came into this awesome company, Ameriplan. And that means I've met some awesome people, some great people. The circle of people that you are around is what you become. If y'all don't believe me, if you're around 5 poor people, Guess who's number 6? Okay, so you want to get around those who want to get you in. And then you get to experience personal development, and that's what this is all about, personal development. You get to read all the books. Keith Strider, Why You Need to Start Network Marketing, The Ultimate Guide to Network Marketing, and one of my favorites, Robert Kiyosaki, his famous book was Rich Dad, Poor Dad. Matter of fact, I do a book club right now. And every Friday at 7 p.m., my book club starts with the book Robert Kiyosaki wrote, the second book he wrote. I don't know if you guys remember. He has another book, and that book is called Second Chance. And I do recommend that if you guys want to really get to know something, you want to read that book by Robert Kiyosaki, A Second Chance. Okay, so we know about network marketing, so what business that you want to get into? The best business that you want to get into is the business that you are invited to today, and that's Ameriplan. And I'm not saying that because I'm in the company. I'm saying that because, if you remember, Zakira told you my background and profession. I'm an actual bail bondsman and a private investigator. So what do? I investigate. Okay? So I think I heard somebody say they've done a lot of business. Was that you? You heard a lot about all these other network marketing.
Oh yeah, I did. Yeah,
right.
I did.
So you did what is called due diligence, meaning that you now found our company, because all those other companies were not exactly what you expected them to be. And that's exactly what I did. I did my investigations. I found out that Ameriplan was the best opportunity because of things like this. You get to operate your own business. Well, most of all companies say you do. Well, you have no employees. All those companies can't say that. We have no employees. We have no inventory. Like Amway, Shockley, Kirby, and Mary Kay. I can go on and on and on. You guys probably been in some of those companies and heard of them, right? Some of y'all still got some of that stuff in your trunk. Or in your garage, right? Okay? So, and like Zakira told you, the heaviest thing we carry all day long is this. And mine is really light and thin too. I love that, you know? Now, you get tax advantages. People always ask me, like I came all the way from, New Jersey by way of Virginia, but people always ask, why do I do all this running around, all this traveling from state to state and all this stuff? Ain't that expensive? Yes, but guess what? It's tax deductible. So y'all say, well, you go spend all this money, you go out to restaurants and do all that. Yes, but I do what? Get it back. Why? Because I'm in a home-based business, the #1 based business in the country, in the Ameriplan, where everything practically I do, I actually get it back. So everybody remember that. Don't think that you're just spending money. You know, people always try to get you away from these kind of business. Best business to be in is a home-based business because you get all that money back on your taxes. These are the plans that Zakir went over earlier, and this is what we get paid to do, to help people. Okay, and we earn a 40% commission on all those memberships that we actually sell. Okay, so, and she told you it was residual, which means what? Yeah, just like your cell phone, right? You pay that bill every what? Every month. So somebody gets a percentage every what? Every month. Well, that's what you got to do here. We have the dental, we have the medical, and we have the Deluxe Plus, which means both combined dental and medical, we earn 40% commission off of. Now, the key is to be here long enough to have some great things happen for you. What do I mean by that? So how many families can you help save money, earn a long-term income potential as the enrolling benefit consultant? That it says IBO, but this is, like I said, this is old slides, and we have to adjust as we go. But how many of us can see ourselves enrolling 100 dental plans or medical plans or combo plans? Anybody? How long do you think it'll take you to find people with teeth and eyes? Right? It's just that simple, right? You know? But if it took you 5 years, okay, let's say it took you 5 years to find 100 people, okay? Well, you get 40% commission off of those 100 people. Okay, you got 40% of 100 people on a dental plan. That's $998 coming to you every single what? Every single month. How many of us in here is getting $998 coming to them every single month right now? I mean, additionally to going on whatever else you do. Okay? So in 5 years, well, what if you took 10 years and did 250? Now you're taking home $2,495 every single month. Every month. Every month. That's whether you get out of bed money or not. Everybody understand that, right? Okay. What about 500? 1,000. Does that seem too astronomical to happen? Why? How do you know? How do you know you can enroll 1,000 people in a few years? 5 years, 10 years. How do you know that? You should know.
It's been done before.
Thank you. Why y'all see I'm pointing at her? She was invited by who?
Jamie Jones from Texas.
Jamie Jones from Texas. I know Jamie Jones.
Wow.
She's one of our company millionaires. Okay? Somebody who also has over what? 1,000 plans. You see that? We have people already in this company who has this in place, who's already earning $9,000, $10,000, $15,000 every what? Every single month. $20,000, $30,000, $40,000 per what? Per month. And the other reason why you know it can be done is because of what? Where are you? No, you're in North Carolina. Where? You're in America. You're in a country with the what? Worst healthcare system. ACA was when Obama was in there, right? Now it's HCA. I can't even get those letters right. Which is for who? Trump thing, right? Everybody confused right now of how, of what to have and what's better. And so who they looking for? She said me. You know, which means she can get 1,000 of them. If you get 1,000 people and you're getting 40% off of them, that's $10,000 a month. Everybody see that? That's not something that I'm just joking about. That's actually a fact. Okay? All right? Now, the other thing is earning income from teen residual overrides, right? How can I break this down to you? Anybody ever heard of J. Paul Getty? Some of y'all use his gas. You heard of Getty gas, right? Okay. Well, Getty, he has a famous saying. Remember I talked about personal development earlier, the books and stuff? Getty's saying is that he'd rather get paid 1% of 100 people's efforts than get paid, to get paid 100% of his own. Did y'all get that? And that's what most of us do all our lives. We only get paid 100% of our own effort. That's it. But now you get to learn how to leverage your income, meaning getting paid for the work of others. Anything wrong with that? No. Ask all the athletes here in North Carolina. Take Cam. That's Dad. Okay? We're in North Carolina. Let's talk about it. You know? He makes $23 million, right? Somebody got to pay him, though, don't they?
Right.
All right? So what that person must be making. How about $23 billion? Right? In order to pay him $23 million, okay, for what he does. So here in Ameriplan, Zakir broke it down for you about the different plans that we have. So if you enroll 10 plans, 10 pieces of business, period, okay, you're going to reach our first manager level, which is regional sales director. And you're going to also get 5% on the...
Hey, Ma! I'm on TV!